Hello YouTube, I'm Dr. Fox. Today, I'd like to talk about sex and aging men's issues. So first of all, what changes might older men see in their sex lives? Everyone's body changes when they get older. Both men and women go through hormonal changes in middle age, and it's normal to have a little difficulty adjusting. Some may worry that their sex life is coming to an end or that they are no longer attractive, but it is completely normal for middle-aged and older people to be sexually active. Okay then, is there any age limit on men having sex? My answer is no. Men usually go through hormonal changes which affect their sexual activity in their early 50s. About the same age, women go through the menopause. However, the decline in testosterone, the male hormone, is much slower than the drop in estrogen, the female hormone. When these hormone changes happen, older men may find that their erections are not as fine as they used to be. The orgasm is less intense and they produce less semen, and they need more time between one orgasm and another. Also, they may find it less easy to get an erection just through thinking about sex or looking at pictures and need direct physical touch from their partner to get hard. Okay, next question. Do people get less interested in sex as they get older? Older people's sex lives are not discussed as much as younger people's, so some assume that they lose interest in sex. This is not usually true. Sex may be different, but that doesn't mean it's less meaningful or enjoyable. As people tend to live longer than they used to, their sex lives tend to last longer as well. For example, one recent study of people aged between 40 and 80 shows that over 80% of men and 65% of women had sex during the previous year. Both men and women said they had sexual problems, but they also said they solved them by finding new ways to be intimate. For example, watching erotic films together. It is very important for people to be able to talk openly to their partners if any age-related problems occur and to be sympathetic to each other. Okay, next. What is erectile dysfunction? Erectile dysfunction, or ED, means a man cannot get and keep an erection either most or all of the time. So, how can ED be treated? Firstly, you have to find out what's causing it, and ED can have mental, emotional, and physical causes. If you think you have ED, visit your doctor for a checkup. If you are finding it more difficult to get and keep an erection, you are not alone. Don't assume it is happening just because you're getting older, because there might be another explanation. Half of all men aged between 40 and 70 sometimes have ED. It can be due, at least in part, to taking certain medications, smoking, taking drugs, not having enough exercise, or drinking too much alcohol. Never buy drugs online to treat ED, as they may be not only fake but dangerous. Your doctor may prescribe a type of tablet for it. If you cannot take this type of medicine for some reason, or if it doesn't work, you could also try other options as well as talking to a qualified sex therapist. Okay, next. What is a sex therapist? A sex therapist specializes in assessing and treating sexual and relationship problems for individuals or couples. This is talking therapy, so there are no medicines or operations involved. The therapist will discuss your issues with you, identify factors that may trigger them, and put together a treatment program. Sex therapy cannot only be very effective in resolving sexual difficulties, but also helps people develop healthier attitudes towards sex and improve their sexual and intimate relationship with your partner. You might have sex therapy even if you are also taking medicine or using some other form of treatment. Always check the therapist is qualified and registered. Okay, next question. Does illness affect sex? Illness can affect sex, and older people are more likely to be ill or disabled in ways that affect their sex lives, whether physically or psychologically. For example, if you suffer from a painful condition like arthritis, it may be difficult for you to find a comfortable position for sex. Some neurological problems can reduce sex drive and cause erectile problems. Certain types of medicines also have side effects which affect sexual activity, and diabetes may cause ED. Illnesses can also have psychological effects which affect sexual activity. If you or your partner have been diagnosed with a life-threatening or life-limiting illness, or your appearance have been affected, this may have an impact on your sexual confidence and libido. If you or your partner have cardiovascular problems like high blood pressure, heart disease, or previous stroke, you may worry that having sex could be dangerous. If one partner becomes a carer for the other, they may feel they should not want to have sex with the dependent partner. In many cases, carers get so tired and stressed that they are not interested in sex at all. Equally, changes within the family can cause you to see yourself and your partner differently. For example, when your children leave home or you become grandparents, which can either make you feel old or that you have started a new, exciting chapter in your life in which you have more time for each other. If you think that illness is damaging your sex life, see your doctor and ask for help or referral to a sexual therapist. Last, what if you are embarrassed to ask for help? Don't be. The doctor and all the other medical staff you will see are completely used to dealing with these issues. Older people, in particular, sometimes find it difficult to talk about sex, but remember, all the sexual health services used by young people are also there to help you. Just because it is not talked about so much does not mean that middle-aged and older people stop having sex or needing help from sexual health workers. Okay, thank you for watching. See you soon.